Doctor, it's good to see you again. I enjoyed our conversation yesterday. Let me just ask you about the massive increase that we have seen in recent years when it comes to children and what we're seeing with chronic diseases, autoimmune diseases, developmental disabilities. This is something that Secretary Kennedy has talked extensively about. I know that you share his concerns on this. What can CDC do to help reverse the spread of these kind of chronic conditions in our country?
Welcome to Inside Washington, the place where the nation's biggest political battles unfold. We take you straight to the source with real-time coverage from the House and Senate floor. No filters, no spin. Just the moments that move America. Tap subscribe now to stay locked in on every critical hearing and confrontation from the heart of D.C.
Yeah, this is a very important issue to me, and it's a very important issue to the Secretary as well. I think, as CDC refocuses its efforts specifically on communicable diseases to prevent, detect, and respond to infectious diseases and emerging threats, we'll be laser focused on that area. But I think we will continue, and I will continue to make sure that we're supporting the Secretary's vision on overall making America healthier again, making sure that we're supporting his initiatives to improve food sources for our children, making sure that we're supporting efforts to allow our children to enjoy physical activity, making sure that we're supporting clean water that is available to them, to really reduce all of these conditions that are leading to exactly what you just talked about, chronic diseases in our children, which ultimately is a public health threat that we just cannot continue to promulgate in this country.
We have seen in Missouri, we've seen a significant increase in chronic health diseases in children, particularly in the St. Louis and St. Charles areas. That's on the eastern side of my state. One of the reasons for this is the presence of nuclear radiation and nuclear toxins in our soil, in our air, and in our water. Are you familiar with the Westlake Landfill Superfund site in Bridgeton, Missouri? Do you know what I'm talking about?
I'm not familiar, but this is something that, again, these are very important issues to me, and I'm happy to work with you if I'm confirmed as CDC.
This Superfund site dates back to the Manhattan-era uranium enrichment project. St. Louis was a uranium enrichment site during the Manhattan Project, of which we're very proud. But after the uranium enrichment was shut down, the federal government did not dispose of the nuclear waste. What they did instead is they dumped it into a public landfill. They allowed it to sit out in barrels that were exposed to the elements for years. So it was dumped into a landfill from which it ran into the groundwater. It sat out in barrels in another site for years, from which it then seeped into a nearby stream where there's now suburbs built. They started building in the 1950s. People have lived there ever since. And if you look at a heat map...
If you are feeling this video, make sure you hit that subscribe right now for more raw political coverage like this.
For childhood diseases linked to nuclear toxins, to breast cancer rates and other forms of cancer, particularly in women, we have some of the highest rates in the nation right there, right around this area. And I'm asking you because, as CDC director, you've got jurisdiction over the Agency for Toxic Substances and Disease Registry. Back in 2015, this agency did a health study on this landfill, on the Bridgeton landfill, on the nuclear radiation that was in St. Louis, and what the ATSDR concluded was that there was not significant pollution, that there was no health risk, I want to quote this, no health risk to the surrounding community. Now, since that time, we have learned that, in fact, the ATSDR report relied on faulty data. It relied on faulty methods, and there have been multiple subsequent reports, including those done by the government and the Army Corps of Engineers, that have shown that there is, in fact, extensive contamination. And as we speak right now, the Army Corps of Engineers is moving people out of their homes in the St. Louis area, those who live adjacent to this creek where the toxins are. They're moving them out of their homes because of existing, continuing nuclear radiation in their homes, in their yards. We've had schools that have been closed because of the presence of nuclear toxins in the air, in the dust, in the soil. Here's my question to you. Will you work to ensure that ATSDR, if you're confirmed, that ATSDR reviews its methodology and does another thorough study that corrects its faulty methodology from the past and gets the facts to the people of Missouri that we deserve on this issue?
If I'm confirmed as a CDC director, we will definitely look into this, and I'm happy to follow up with you.
Good. I'll just point out that it's so significant, it's so bad, ATSDR study, that the Reuters news agency did an entire report that we will make sure that you see, detailing the faulty data and, frankly, haphazard process that ATSDR used to issue this report that has been relied on, I might add, by corporate bad actors and other polluters to say, oh, see, there's nothing wrong, even as other agencies of the government are telling people, no, you have to leave your home because you've been exposed to nuclear radiation. We absolutely have to get this fixed and have to get it cleaned up. I look forward to working with you on that. I'll have other questions for you for the record. Thanks again for being here. Thank you, Mr. Chairman.
If this video is giving you a clearer view of what's happening in Washington, please smash that like button, share your thoughts in the comments, and make sure you're subscribed for more raw political updates. That's it from Capitol Hill, but the conversation doesn't stop here. If you want more, no nonsense, straight from the source coverage of America's most important political moments, make sure to like, comment, share, and subscribe to Inside Washington. More hearings, more truth, coming your way.